This video is created for physiotherapy education and learning purposes only. The demonstrations and/or explanations are as per our experiences and are generalized and may not be appropriate for every patient or condition which is more specific. This content should not be used as a substitute for textbooks but just as an aid to formulate answers better.
Hello, I am Dr. Ravina and today we are going to talk about cardinal planes and axis. Before we begin, let's look at the most commonly asked university paper questions with regards to cardinal axis and planes. So as you can see, there are multiple questions that are asked, which are all 3 markers as well as 7 markers as well as 15 markers. Now here in the 15 markers, wherever I have striked off, it's basically a question from some other topic. So like here it is about the biomechanics, here it is about the Newton's law. Since this particular video is based on cardinal axis and planes, so I have stuck to the questions and I will be answering those subsequently in the following slides. So first and foremost, let's look at what are axes and planes. So we'll go through the definition, which has to be word to word as per the textbook. So an axis is a line about which the movement takes place. Okay, so there are the 3 types, which is sagittal, frontal and vertical. Likewise, we have the plane, which is a surface which lies at right angles to an axis and in which the movement takes place. So you see the word play, about which is the axis, in which is the plane. So again here planes are of 3 types, which is frontal plane, sagittal plane and the horizontal plane. Moving ahead, let's discuss about sagittal axis and frontal plane. So now if you see this person, the sagittal axis is the one that goes antero-posterior and the frontal plane is the one that lies mediolateral. So sagittal axis, as the name suggests, it goes parallel to the sagittal suture of the skull, which lies here, that divides the brain into the 2 halves, left and right. So it goes in the antero-posterior direction as we've discussed. Okay, and 90 degrees to that lies your frontal plane. So the common movements that occur along this are the abduction and adduction movement, except for thumb. Thumb is positioned slightly differently. And you can have the neck side flexion or the trunk side flexion that also occurs along this plane and axis. Let us now discuss about frontal axis and sagittal plane. Now if you look at this image here, frontal axis is the one that goes mediolaterally and sagittal plane is the one that goes antero-posteriorly, dividing the body into left and right half. So basically your frontal axis, as the name suggests, also called as coronal axis, lies parallel to the coronal suture of the skull. So coronal suture goes mediolaterally like this. So unlike the sagittal suture which goes antero-posteriorly, so mediolaterally to the skull, so it is parallel to that. That is why it's also called as the coronal axis. Okay, so the movements that commonly occur here are flexion and extension movements, except in the thumb, because again thumb is placed slightly differently. So you can quote those as the examples in frontal axis and sagittal plane. When we look at the vertical axis and transverse or horizontal plane, we see that it is the plane that is going through such that the body is divided into upper and lower half, and vertical again is from up to down, that is the axis. So it is along the y-axis. Okay, so and it goes parallel to the line of gravity that goes from up to down. Okay, so the movements that commonly occur in this plane and axis are internal and external rotation. So just to summarize, if you see, your frontal axis is the x-axis, the vertical axis is the y-axis, and the sagittal axis going antero-posterior is the z-axis. So if you are asked a question on axis and planes with regards to definition, it would be nice if you are able to define them, talk about the subtypes, that means how many types of axes are there, how many types of planes are there, talk about the movements which occur in each axis and plane combination, and also give an example if possible. So if you look at the current slide, it basically talks about the various movements that possibly occur in the different planes and axes at the different joints. Okay, so this is a very basic level explanation. There may be more complex movements also happening. Like for example, knee joint is also known to have some amount of rotation and abduction, adduction, etc. But that we will learn later over the upcoming years. But currently, as a first year, we need to understand that these are the major movements that occur at the shoulder, elbow, radioulnar wrist, hip, knee, ankle, and subtalar joints, which can be quoted as examples in your answers. Let us now look at the uses of cardinal axis and planes. So first and foremost, it is said that it is used to describe and define human motion. So now if I specifically say that a particular movement is occurring, say 90 degrees in sagittal plane and coronal axis, I clearly understand, or everyone understands, that I am talking about flexion, because the movement that occurs in sagittal plane and coronal axis is flexion. So it's kind of like a unified language. Secondly, it tells us about the degrees of freedom in a particular joint. So for example, a particular joint allows movement only along a single axis and plane, then it is called as 1 degree of freedom. So for instance, if a joint only allows flexion and extension, okay, so that is called as 1 degree of freedom. If a joint allows flexion, extension, abduction and adduction as well, so then it is 2 degrees of freedom of movement, because it is along two axes and two planes. Okay, likewise, if it allows flexion, extension, abduction, adduction as well as internal external rotation, it is called as a 3 degrees of freedom of motion. Okay, it also tells us about the location of displacement, whether it is antero-posterior, whether it is superior, inferior in a particular place and plane. Okay, and of course it is the basis of biomechanics, because it helps in analysis of kinematic data in humans, which eventually helps in movement analysis, which is an important aspect as a physiotherapist. So therefore cardinal axis and planes are important. And also a lot of radiological investigations like MRIs and CTs, they interpret data on the basis of cardinal axis and planes. That means the films that are formed, they can have like sagittal view or coronal view or etc. So we understand how the slices are interpreted in these investigations. Next thing we need to understand is the need to study the cardinal axis and planes. Why do we need to study them? So like we've discussed, the use is somewhat similar, but it is useful in describing a movement, okay, a unified language for everyone. It helps us in doing a movement analysis, which is again a part of biomechanics. So it's a biomechanical analysis. Okay, so now I've just given an example here, so which you can also quote in your answer. So if suppose we are checking, okay, normally your shoulder joint has to have 0 to 180 degrees of flexion, which occurs in the frontal axis and sagittal plane. But suppose a person comes to you with frozen shoulder or any shoulder pain, and he's not able to go up to 180 degrees. So you can clearly discuss that it is 0 to 160 degrees only that he's able to achieve in frontal axis and sagittal plane. And maybe after 160 degrees, he's going in a little bit of deviated movement. So you say that it is deviated from the frontal axis. Okay, so that helps us in giving an analysis of the movement as to how the movement has been broken down. And definitely as physiotherapists, we need to identify the faults. So once we know that there is a fault in this plane and this axis, then we plan a rehabilitation accordingly. Let us now discuss the plane of movement in relation to gravity. So if you see, there are three planes that we are going to discuss. We have the horizontal plane, we have the inclined plane, and we have the vertical plane. Now if I can draw on the side, if you can see, this is your vertical plane. This will be your horizontal plane. And any movement that occurs in between this, okay, this, or if I say this, that becomes your inclined plane, correct? Now if I am doing a movement in horizontal plane, that is this plane, okay, the movement is this way, okay, from left to right, internal external rotation, those kind of movements, correct? So it's neither going up, which is against gravity, nor it is going down, which is towards gravity. So that is why this plane is called as the gravity free plane, okay, or the gravity eliminated plane. So generally when there is a lot of weakness in the muscles, okay, like say for example, there's a nerve injury or something like that, like brachial plexus injury, and you want to start training the muscles, you will probably start with a gravity eliminated plane, which is your horizontal plane. Now, when we come to the vertical plane means two things. One is movements away from the gravity. Okay, that is called as concentric muscle work. One is movement towards the gravity. That is called as the eccentric movement. Now, when it is against gravity, the muscles have to generate good amount of force to allow the movement to happen against gravity. Likewise, when it is towards gravity also, the muscle has to do controlled work, okay, so that the fall is not there and there is a controlled movement towards the gravity. Okay, so this is when the movement is in vertical plane, up and down. But sometimes we tend to do, oblique movements, sometimes in this plane, sometimes in this plane, whatever we are doing. Okay, now if that incline is more towards the horizontal, that means this is horizontal, that incline is somewhat here. Okay, so that tells us that the muscle has to do some work but less work against gravity. But if that incline is more towards the vertical, that means say the incline is this way, that means it is relatively more against gravity as compared to horizontal, so it has to do more muscle work against gravity. So this is all they try to explain the plane of movement in relation to gravity. So what do you expect while writing the answers for cardinal planes and axes? First of all, read the question appropriately and marks that are allotted. Okay, don't write lot for just 3 marks or just little for a 7 marks. Understand how much marks are allotted. If they've asked just enumerate, you just simply write down what the axis and planes definitions are, classify them, and maybe one line just describing each axis and plane should be good enough. Now, if they are saying describe or discuss, okay, we probably need to talk apart from the initial definitions and classifications and one-line descriptions. We might also need to talk about the movements that occur in that particular plane, as well as the diagrams which define those movements. Okay, so a simple stick diagram like we have shown in the previous slides could be done. Likewise, if there's a long answer question it is asked and you want to probably add something about the uses or the needs or probably the effect of gravity with regards to the movements in different axes and planes with examples, it will definitely fetch better marks. So this is about it for axes and planes, the way you're supposed to write. If there are any queries or doubts, please feel free to post the questions in the comment boxes. I will try to answer them as and when possible. And if there are any other videos that you want me to make, any other doubts that you have, then you please feel free to mention it in the comment boxes again, and I will try and take it up subsequently. Thank you for watching.